From rats in Argentina to a cruise ship in South Africa, the spread of the deadly Hantavirus now has doctors in Texas on alert.
It is concerning.
State health officials say 2 people on that cruise ship in the Atlantic have returned home to the Lone Star State. They say they left before doctors identified the outbreak, have no symptoms, and had no contact with sick people on board the boat.
You can still develop symptoms even up to 6 weeks after the initial exposure.
Infectious disease Dr. Nikhil Bayani says most show symptoms within 2 to 3 weeks. The state says the 2 Texans on the cruise have agreed to take their temperature daily and tell doctors if they get sick.
Since there's no treatment and the virus can have some very serious consequences in the patients, and a lot of these folks develop severe breathing problems, which ultimately can lead to death in almost over 40% of the patients.
The state is not saying where in Texas these 2 live. Dallas County public health officials say they don't have anyone they're monitoring, but Texas now joins 4 other states, keeping an eye on passengers from that cruise.
The virus can spread through close and intimate contact.
State health docs say it's not known to be spread by shaking hands or simply being in the same room as someone, and the general public need not fear another COVID-style outbreak, Dr. Bayani says.
Not at this point. I don't think so.
Just be aware, he says, the deadly virus with worldwide attention now has a Texas tie. Reporting in DFW, I'm Cole Sullivan.
We want to give you a better look at the timeline of this outbreak. The cruise started in Argentina on April 1st, where the original patient likely contracted the virus on a bird watching tour before the cruise. His wife also got it and died after flying from St. Helena to South Africa. The ship docked in Cape Verde May 3rd and will ultimately end in the Canary Islands. In total, 3 people have died, a Dutch couple and a German national. There are now 6 confirmed cases and 6 suspected.
Well, you heard Dr. Bayani. The symptoms can start off like a bad flu, but quickly escalate into a respiratory emergency. You may feel fever and chills early on, along with achy muscles or headache. Some patients get nauseous, experience stomach pain, vomiting, or diarrhea. As the infection gets worse, hantavirus damages the lungs and causes fluid to build up, leading to bad coughs, trouble breathing, low blood pressure, and an irregular heartbeat.